When surveyed about the five senses, that is sight, hearing, taste, smell and touch, study has shown that people consistently say that their eyesight is the mode of perception they value and fear losing most.
Nikipoteza macho, kuguza na kusikia, nitasikia vibaya zaidi ni macho. Unajua macho nitaona mwenye ananifanyia vitu.
Katikati ya kuguza, kuona na kusikia, mimi zote zikipotea nitasikia vibaya.
Sababu gani?
Juu kama macho nitaona unaonanga mwenye anaenda na kamuti hivi, anayesarushwa kwa mtaro ama kwa shimo juu aoni, lakini kama niko na macho yangu na nijionea, siwezi rushwa kwa mto.
Kati ya kuona, kusikia na kuguza, nadhania nikipoteza kuona naweza kuwa kwa shinda kubwa zaidi, sababu sitaweza kufanya mambo mingi.
Kwa mimi binafsi naona kupoteza kuona macho itakuwa ni jambo ambalo linigusa sana. Mnake macho ndio kila kitu, naweza kuona, nitembee, nijiepushe na hatari.
According to me, I see if I lost seeing, that one might be worse to me, because before making any of their judgment, according to me, I have to see something before making a conclusion about it.
Despite this, many people don't have an understanding of the anatomy of the eye, how vision works, and health problems that can affect the eye. Being an organ of sight, the eye has various parts. Each of these parts play a very crucial role in helping you see clearly and interact with your world.
So the eye consists of several parts. So starting from the front, you have the eyelids, then you have the white part, which is called the conjunctiva, and beneath it is called the sclera. Then you have the transparent part right in the middle, it's called the cornea. And behind that you have your pupil and iris. And behind that you have the lens. And then the last part of the eye, which is the back part of the eye, you have the retina as well as the optic nerve.
To produce clear vision, the eyelids protects the eye. The conjunctiva keeps the front part of the eye moist, protects the eye from dust as well as infections causing microorganisms. Sclera is the white part of the eye that protects the eyeball, iris and lens by carrying nutrients, removing waste products from the lens and maintaining the shape of the eye. The pupil or black dot at the center of the eye is an opening through which light can enter the eye. The iris or colored part of the eye controls how much light enters the eye by changing the size of the pupil. The cornea, a clear window at the front of the eye, covers the iris and the pupil. The retina is a light-sensitive inner lining at the back of the eye. Because good vision is important, to ensure that the eye is healthy, one is advised to eat a balanced diet, exercise, have a good night's sleep, avoid smoking, wear sunglasses, and most importantly, going for eye checkups at least yearly.
The human eye is a very important organ of the body. It serves as a king, as nothing can be done easily without it. This delicate organ needs proper care and attention because the loss of it can throw one into total darkness. Some people are born without sight, while others just develop complications later on in life, and that's why eye checkups are very crucial.
We set out to determine eye illnesses and corrections in Kenya. In this effort, we visit one of the leading and few eye hospitals in the country. On average, the PCEA Kikuyu Hospital Eye Unit handles about 250 patients per day, which amounts to about 5,000 patients per month and 80,000 patients in a year.
The eye unit is actually a very busy unit that we usually see, and we see an average of 250 patients per day, which makes it very busy. This is because we offer a wide range of services that are provided in the unit, and that includes optical services where we also check eye visual acuity and different conditions of the patient. We also give them spectacles where we do outsource the services, but they can get them from here. We also have surgical services for the very patients who come here. So we do have theaters that operate on a daily basis, and they are actually run by our various consultants and the ophthalmic consultants as well. We have a total of about 9 consultants who have been working with us here for quite a long period of time. And we also have subspecialties that can only be found in Kikuyu and mainly not even in the other hospitals that are around. Okay, we found it very interesting with this coronavirus outbreak, whereby as soon as they announce the number of patients who have coronavirus, I think generally the public also panics and would like to stay away. So the number of patients have reduced. But that does not mean that you will not get sick. And we've had a lot of patients who are still sick and they still need to be seen by the doctors. The doctors have been available and we've been seeing the patients every day. But what we decided to do to reduce the crowd is to reduce the number of patients who are actually being seen in the unit and provide protective gear for the patients. Also provide a shield so that you do realize that we realize that a lot of the patients are very close to the doctors. So of course we provide them with protective gear, that is including facial masks, goggles. We provide a shield that can protect them from coming into contact with the patient so that we can reduce the number of patients. We also started monitoring in terms of their surgeries, the number of surgeries that are there, also to reduce the number, just to reduce the contact as well.
Many people aren't sure what to expect when they make an appointment with an eye doctor, especially if they've never had a comprehensive eye exam before or it's been many years since their last exam.
The visual acuity area, this is where the vision assessment is done. They are shown charts to read to see how well they can read, and this is recorded on the patient's file. After that, the patient is taken to the consultation room, and that is where the clinician takes the history of the patient, finds out what it is that brought them to the eye unit, finds out other areas about them, like other diseases that they could have that may impact the eye. After the history taking, they are examined on the slit lamp. After that, now the clinician makes a decision on what is the best way to treat them. If the problem was spectacles, they will be sent to the optical shop where the spectacle assessment is done and the spectacles are prescribed. If the condition needs eye drops, they are referred to the pharmacy where they buy the eye drops. If they need to be admitted in the ward, they are also directed to the eye ward for admission. If the condition needs surgery, they are directed to the booking office where they are given a date at which the surgery will be done. However, if the surgery is an emergency, it can be done the same day or the following day. At times, you find after treating the patient, the vision cannot be improved much. So these patients are taken to the low vision department, whereby a low vision assessment is done, and if there are devices that can help the patient, these are prescribed, and this includes things like telescopes, magnifiers. At the low vision department, rehabilitation is also done, where they are taught on how to adapt with the reduced vision or the little vision that they have, or even no vision, so that they can perform their daily tasks of life. They are also taken to, they are told which schools that they can join if they have reduced vision, colleges, training institutions, and also they are referred to organizations that assist people with visual impairment. And some of these organizations are run by the government. You can focus at the machine. So I'm looking at that light. No, at the machine, like with this eye, looks at the machine. So now I'm looking at your eyelids first. I'm looking at your eyelids and your eyelashes. So this is the lower one that I'm looking at, and then I look at your tear drainage system. Then I'm looking at the upper eyelids and the lashes and your tear drainage system. So those are normal. Then I'm looking at the white part, which is the sclera and the conjunctiva, and it's good. Then the cornea, the transparent part, it's clear. Then at your iris and pupil, they are okay. And then I go to the other eye, I do the same. And that front part of the eye in both eyes are normal. Then I use the lens to check the back part of your eye. You don't have a cataract. Then focus still on the machine. This is just a lens. So I'm looking at your retina. And then I'm looking at your optic nerve, which is normal. Then I come to this other side. Your lens is also clear, and I'm looking at your retina. Focus on this part of the machine with this eye. Focus there. Your forehead needs to touch there. So I'm looking at your retina, which is normal, and your optic nerve, which is normal.
Eye doctors use a wide variety of tests and procedures to examine your eyes. These tests range from simple ones like having you read an eye chart to complex tests such as using a high-powered lens to visualize the tiny structures inside your eyes. At the PCEA Kikuyu Hospital, there are 9 examination rooms ensuring that there are adequate number of clinicians to attend to the large number of clients that visit the hospital daily. The key to effective treatment and management is proper and accurate diagnosis.
Eye checkups are recommended to be done every year because there are certain eye conditions that may not give you any symptoms initially until it's too late. So it is important to have an annual checkup. It's also important to have an eye checkup at the slightest noticing of symptoms by the patient. And these symptoms should not be ignored, no matter how slight they are.
From these statistics, it's evident that there are numerous ailments of the eye, from vision correction, eye infections and irritation, diseases and disorders, eye injuries and chronic conditions.
So the major eye illnesses are cataract, glaucoma, refractive errors, squints, tumors, eye traumas, retinal diseases. The most common eye conditions that lead to loss of sight are cataract and refractive errors. Those are the leading causes, as well as glaucoma, corneal opacities, and even retinal diseases.
Eye specialists have made incredible advancement in eye corrections for the various eye ailments, which include lenses, eyeglasses, laser, or artificial eyes. Dr. Masila tells us what the corrections improves and how they all work.
So for cataract, it mainly is an illness that comes with advancing age, and it presents with reduction in vision, which is usually painless, and chronic, meaning it occurs over a long period of time. How to identify it? You'll see a white opacity in the center of the eye. It is treated by doing an operation called cataract surgery. Refractive errors, the main complaints are reduction in vision. It can occur at any age, all the way from childhood into adulthood and even older age. It is identified by performing an examination using lenses, which then are the ones that correct it. And these lenses are put inside spectacles, and they are corrected by spectacles. So cataract, apart from occurring in the older age group, can also occur even in newborn babies and very young children. In this case, the babies or the children are born with cataracts, and they too have to have cataract surgery done so that they avoid losing their vision. For refractive errors, these are a group of conditions where the refraction or where the focusing power of the eye is not as it should be, and it is divided into long-sightedness, where the person can see objects or images that are far, but they cannot see images that are near. Short-sightedness is where the patient can see images that are near, but they cannot see images which are far. And we have the reading problems in the older age group called presbyopia, where the patients complain of difficulty in reading, like newspapers or performing near work. So short-sightedness is also called myopia, and it is corrected with glasses. Long-sightedness is called hyperopia, and it is corrected with glasses. Presbyopia is also corrected with glasses. There are other ways of correcting these conditions, such as use of contact lenses, laser, and even surgeries.
Over time, chronic diseases such as arthritis, diabetes, and cancer, just to mention a few, can also cause damage to the eyes, leading to poor vision and even blindness.
Another eye illness that is becoming very common, and we see a lot of cases of that, is diabetic eye disease. Mainly the retina is affected, where in diabetic patients there can be several bleeds, and if this is not corrected early, it can eventually lead to loss of sight. So all diabetics should have an eye exam to determine if diabetes has affected the eyes. Other conditions that are very important to pick out are tumors or growths. So tumors need to be detected early, so any small growth needs to be checked and treated very quickly because it could even be cancerous. And a common childhood cancer is called retinoblastoma. Happens in children from birth all the way to 2 years. And initially it just presents like a white opacity in the eye or a squint or a red eye. But if it is not corrected early, the cancer can grow and eventually threaten not only the sight, but even the life of the child. And retinoblastoma needs to be picked early and treated early. And lastly, we have eye traumas. The mistake that usually happens is when somebody undergoes eye trauma, they don't come immediately. They go to the pharmacy and just buy eye drops. But unfortunately, there are many conditions going on inside the eye. So by the time they come again, it may be too late. So anytime one has undergone eye trauma, it is good to have it checked and treated early.
Other than identifying the problem and trying to correct it, the specialists also follow up on their patients to offer counseling. The Kikuyu Hospital also creates awareness on the same and advises the masses to regularly go for eye checkups.
This is someone's eye. This is what?
Yes, this is the right image and the left image. When we meet patients who have a sight-threatening condition or a chronic eye condition or a long-term eye condition, they need to be counseled about it so that they can adhere to the appointments and also the treatment to avoid losing their sight. So we have a team of ophthalmic nurses who carry out this counseling as soon as the disease is diagnosed, especially diseases such as diabetic eye disease, glaucoma, and even the cancers. We have awareness programs, and these are programs where we educate the public and other members, other patients, clients who are coming into the hospital, not necessarily the eye unit. We counsel them on various eye diseases. Contact lenses should be utilized in the proper manner with very strict hygienic conditions, because if these are not followed, they can cause a very bad infection on the cornea, which, again, if not corrected early, can lead to even corneal scarring and even later corneal blindness. Spectacles ideally should be prescribed after an assessment of the powers of the eyes. If one goes and wears spectacles without measuring, like buying them off the streets, one can buy a power that is either too high for them and it will cause them to have eye strain and headaches, or they can have a power that is too low for them and they can end up not seeing well again. And we all know that if you don't see well, there are certain things that can result, like even falls, accidents, and such like complications. And we encourage the public to come for eye exam.
It is therefore very important to take care of your eyes. Get a comprehensive eye exam probably every year, and also get to know if you're at risk of any eye diseases. Protect your eyes from excess light, and also do not strain your eyes. Get enough sleep. Now visit our social media handles for any questions and comments in regards to today's show. The social media handles are displayed down below on your screen. My name is Aida Munzatsi. Be safe, and as we continue fighting the coronavirus pandemic, kindly adhere to the directives that have been put forth by the government through the Ministry of Health, and together we shall overcome. Always remember, your health matters.